Welcome back our fans. Prognosis of periodontal diseases. Pro equals 4. Gnosis equals knowledge. The prognosis is a prediction of the probable based on a general duration, outcomes, course, knowledge of the pathogenesis of the disease and the presence of risk factors for the disease. Risk generally deals with the likelihood that an individual will develop a disease in a specified period. Risk factors are characteristics that put an individual at increased risk for developing a disease. Prognosis is the prediction of the course or outcome of a disease. Prognostic factors are characteristics that predict the outcome once the disease is present. Outcome: tooth loss, stability of periodontal support. A favorable response may tip the balance and allow teeth that have a doubtful outlook to be retained after TTT initiation. The re-evaluation phase in the treatment sequence allows the clinician to examine the tissue response to scaling, oral hygiene, root planning and chemotherapy if used. It is advisable to establish a provisional prognosis until phase I therapy is completed and evaluated. Maintenance: easy. Can be done but difficult. Cannot be done. Amount of loss: 0, 25%, 50%, 50%. Prognosis classification schemes have been designed based on studies evaluating tooth mortality, good prognosis, control of etiologic factors, and adequate periodontal support ensure the tooth will be easy to maintain by the patient and clinician. Fair prognosis: approximately 25% attachment loss and/or classification. Location and depth allow proper maintenance with good patient compliance. Poor prognosis: 50% attachment loss, class 2 furcation involvement. Location and depth make maintenance possible but difficult. Questionable prognosis: greater than 50% attachment loss, poor crown. 2. Root ratio, poor root form, class 2. Furcations, location and depth make access difficult. Or class 3 furcation involvements, greater than 2+. Mobility, root proximity. Hopeless prognosis: inadequate attachment to maintain health, comfort, and function. Kwok and Caton proposed a scheme based on the probability of disease progression as related to local and systemic factors. Future loss: unlikely to occur. Unlikely to occur/prevent. Unlikely to prevent. Control of local/systemic factor. Can be controlled. Can or cannot. Cannot. 1. Favorable prognosis. Comprehensive periodontal treatment and maintenance will stabilize the status of the tooth. Future loss of periodontal support is unlikely. 2. Questionable prognosis. Local and/or systemic factors influencing the periodontal status of the tooth may or may not be controllable. If controlled, the periodontal status can be stabilized with comprehensive periodontal treatment. If not, future periodontal breakdown may occur. 4. Hopeless prognosis. The tooth must be extracted. Thanks for watching. Support us by likes and subscribes.